Okay everyone, this is Priti and you're watching my solution. In this video, I'll be teaching about the autonomic nervous system pharmacology. That is, first we'll see the overview of nervous system, then we'll discuss in detail of autonomic nervous system. The nervous system in detail is, the nervous system is further classified into central nervous system and peripheral nervous system. Central nervous system is what is present at the central axis, that is brain and spinal cord is the central nervous system. Peripheral nervous system, as the name says, periphery means surrounding that thing. That the peripheral nervous system, the nerves coming from the cranium, this is the brain and the spinal cord, are included in the peripheral nervous system. Peripheral nervous system further we have autonomic nervous system and somatic nervous system. Autonomic nervous system means which has two, like it regulates only involuntary muscles like heart, urinary bladder and smooth muscles. It regulates, autonomic nervous system regulates all these muscles, all these smooth muscles and glands, whereas somatic nervous system regulates the voluntary muscles, that is the skeletal muscles. This somatic nervous system regulates the skeletal muscles. It has only single neuron, whereas this autonomic nervous system has a two neurons. See, one and two neurons are there. This is a ganglion forming the junction between the two neurons will be synapse or ganglion. We can say ganglion or synapse. In CNS we say synapse. Here this is a ganglion. Sympathetic, both autonomic system, both components of autonomic system, that is sympathetic and parasympathetic, both have two nerve fibers. In parasympathetic, this parasympathetic nervous system, this ganglion is close to the organ, whereas in sympathetic this is away from the organ. So in parasympathetic nervous system, preganglion neuron nerve fiber is longer than the postganglionic nerve fiber, whereas in sympathetic nervous system, preganglionic nerve fiber is shorter than the postganglionic nerve fiber. And this applies to voluntary muscles. Whereas ANS supplies involuntary muscles. All involuntary muscles have receptors for both sympathetic and parasympathetic, but at one time only one is activated. To alter the functions, once sympathetic will be activated, once parasympathetic activated. You take this as the kidney has both kidney or heart, it has both receptors, that is for sympathetic alpha 1, alpha 2, beta 1, beta 2. For parasympathetic they have muscarinic and nicotinic receptors. All receptors will be present on this organ, that is visceral organ. Still they will be activated only once in the nervous system. Now we'll see ANS. ANS will see ANS further have sympathetic and parasympathetic. Parasympathetic is craniosacral outflow. Because the nerves comes from the cranium, that is brain, that is 3, 7, 9 and 10. The cranial nerve 3, cranial nerve 7, cranial nerve 9 and cranial nerve 10. Cranial nerve 3 is oculomotor nerve, cranial nerve 7 is a facial nerve, cranial nerve 9 is a glossopharyngeal nerve, and 10 is a vagus nerve. These are included in parasympathetic nervous system. And from the sacrum, S2, S3 and S4. So from the cranium, from the brain and from the sacrum, both nerves come out, so we call as craniosacral outflow. And in sympathetic nervous system, we have thoracolumbar outflow. From the thorax and from the lumbar region, the nerves coming in that region are included in sympathetic nervous system. So this is also known as thoracolumbar outflow. And the visceral organs, has already said that this heart and then kidney or any other visceral organs have dual nerve supply, that is both the components of ANS, that is the sympathetic nervous system and parasympathetic nervous system, but each will be one will be stimulated at that time, other will be inhibited. Other will be stimulated, one will be inhibited to maintain homeostasis. So one will be stimulated. This is all about the complete overview of the nervous system. Now we have already discussed in my previous video. Now we quickly go through that. This ANS will be dealing further, that is receptors in the ANS and all. Now somatic nervous system means it has only single neuron which will supply the voluntary muscles, that is skeletal muscles. The neurotransmitter in this is acetylcholine, and this will be supplying from the CNS. It is coming to the skeletal muscle. So this is a motor neuron. Whereas sensory neuron, it goes from the organ, from the sense organs to the CNS. So that is a sensory neuron. This is a motor neuron which is coming from the CNS to the skeletal muscles. And this is a somatic as it supplies voluntary muscles. like skeletal muscles. And we have ANS. We have two components, parasympathetic and sympathetic. Parasympathetic and sympathetic both have two neurons. Two neurons. In parasympathetic, the ganglion, in between the two neurons, we have ganglion. This ganglion is close to the effector organ, or any glands or anything which is supplying. The ganglion is close to the organ in parasympathetic, whereas in sympathetic it won't be close to the organ. So in this, preganglion length is more than postganglionic length, whereas in sympathetic, preganglion length will be less than postganglionic. And one more thing you should remember, that in parasympathetic nervous system, because parasympathetic nervous system only secrete neurotransmitter as acetylcholine. This acetylcholine, as the name says, this is choline. It secretes acetylcholine. So this parasympathetic is also known as cholinergic. And whereas the sympathetic, it secretes adrenaline, noradrenaline. In the presynaptic junction, it is always acetylcholine here also, only in the postsynaptic junction. So entirely everything will be acetylcholine except in synaptic, postsynaptic neurotransmitter, which may be acetylcholine sometimes in sweat glands and all. Other times adrenaline, noradrenaline, or sometimes acetylcholine, mostly adrenaline and noradrenaline. So this sympathetic nervous system is also known as adrenergic nervous system. This is all you learned about the overview of nervous system, which all are included, and sympathetic, parasympathetic, somatic, how neurons will be arranged, and you know the length of the preganglionic and postganglionic nerve fibers. Now we'll be going into the cholinergic system in detail. The cholinergic system, as the name says, the neurotransmitter in the cholinergic nervous system will be acetylcholine, as the name acetylcholine. So this neurotransmitter in this system is acetylcholine. So the parasympathetic nervous system is also known as cholinergic system. These cholinergic neurons are the neurons which synthesize, store, and then releases acetylcholine. These the neurons whichever synthesize, store, and release acetylcholine are cholinergic neurons. Whereas even though in sympathetic nervous system also, in sympathetic nervous system also, preganglion secrete acetylcholine, but it should be acetylcholine in both preganglion and postganglion. Then we call as parasympathetic nervous system or cholinergic nervous system. Neurotransmitter will be acetylcholine. You are done with this. Like you need not to mug up everything, because I'll be explaining each and everything in detail. So you need not to mug up anything. So just to watch once video, that is more than sufficient. You will remember automatically. So cholinergic neurons are the neurons which synthesize, store, and then releases acetylcholine. Now we will discuss about the difference between the autonomic nervous system and somatic nervous system. Somatic, as the name says, it supplies the skeletal muscles, voluntary muscles. Voluntary muscles, example, skeletal muscles. Whereas autonomic nervous system are auto means self. Autonomic means self-governing. That means they govern themselves. This applies involuntary muscles, because why they govern themselves means one stimulation increases, other stimulation will be decreased. So they are self-governing. They are made up of two neurons, as I have showed in this image. These two are included in ANS, autonomic nervous system, that is sympathetic and parasympathetic. Both have two neurons, 1 and 2. Whereas in the somatic nervous system, only single neuron is there. This point is made up of two neurons, whereas this is made up of a single motor neuron. Here two neurons are arranged in series, that is one after other. This single motor neuron, as the name says, it comes from the CNS to the skeletal muscles. Now this preganglion, the same thing I have draw a diagram, that is two neurons are present in a series, that is in this is a preganglion, this is a ganglion. The neuron before the ganglion is preganglionic neuron, whereas the ganglion neuron which is after the ganglion is called postganglionic neuron. Here also same. In skeletal muscle, only single neuron is there from CNS to skeletal muscles. That is called as a motor neuron. The junction between this cell membrane of the skeletal muscles and nerve ending, and this in between the space, that is synapse, is called neuromuscular junction. These are skeletals. These innervates also. So this innervate all involuntary muscles like heart muscles, smooth muscles, and endocrine glands. Whereas this innervate only voluntary muscles, that is skeletal muscles. So it, as it involves skeletal muscles, it controls skeletal muscle too. These are involved in visceral functions because it supplies smooth muscles. Smooth muscles means it is involved in GIT, that is digestion function. Whereas exocrine also like the enzymes or the enzymes that are secreted into the GIT are exocrine. Exocrine means which have ducts, that is bile duct or pancreatic duct, salivary glands. All these are exocrine glands. Exocrine glands also helps in digestion, and the heart helps in circulation, and smooth muscles only finally excretion will be happen. So these muscles only will be like the muscles which are involved, same functions will be also there. This is all about the difference between the somatic and autonomic nervous system. There's autonomic, as the name says, self-governing, and this controls involuntary muscles, whereas somatic muscles controls voluntary muscles. It will be having two neurons which are arranged in a series, whereas this is only single neuron. This supplies voluntary muscles, so skeletal muscles are involved. These are involuntary muscles, all involuntary muscles like heart, smooth muscles, and exocrine. The functions of these muscles will be the function of the autonomic nervous system. This is all you learned for this video. If you find this video helpful, please do like, share, and subscribe to my channel. And for further videos, please follow my daily videos.